Welcome to Clinical Capsules, where we bring you the same evidence-based insights you trust from TRC Healthcare, now in podcast form. We're thrilled to launch this new series as we celebrate 40 years of keeping healthcare professionals ahead of critical medication updates and guidelines. Every second and fourth Tuesday, our expert editors from Pharmacist Letter, Prescriber Insights, and Pharmacy Technicians Letter will break down the most impactful clinical developments, giving you clear, actionable takeaways in just minutes. Today, you'll hear an excerpt from our September 2024 Pharmacy Essential Updates Continuing Education webinar series. In this segment, Associate Editor and Pharmacist Sara Klockars examines a new drug for COPD, Ensifentrine. With that, let's get started.
Now let's discuss a new drug for COPD, Ensifentrine, or Ohtuvayre. As our article states, you'll get questions about Ensifentrine, a new nebulized med for COPD maintenance therapy in adults. So how does Ensifentrine work? Ensifentrine inhibits phosphodiesterase 3 and phosphodiesterase 4. So let's talk a little bit about what that means. Phosphodiesterases are enzymes found throughout the body. They break down cyclic AMP and cyclic GMP, which are cell messengers that impact many processes in the body and help keep things in balance. They work in the lungs, the liver, immune system, heart, and blood vessels, to name a few places. But sometimes the phosphodiesterases or cell messengers get out of balance and cause different conditions or diseases that can be treated with phosphodiesterase inhibitors. You're likely familiar with some meds that inhibit certain phosphodiesterases. For example, the phosphodiesterase 5 inhibitor sildenafil can affect smooth muscle to treat erectile dysfunction or pulmonary arterial hypertension. Roflumilast is an oral PDE4 inhibitor for severe COPD. And we may see oral apremilast or topical roflumilast or crisaborole for different inflammatory skin conditions. We also have some PDE3 inhibitors such as cilostazol or dipyridamole. And then we have Ensifentrine as the first dual phosphodiesterase 3 and phosphodiesterase 4 inhibitor. So Ensifentrine inhibits the phosphodiesterase 3 and 4, which prevents the breakdown of the cell messenger cyclic AMP, which increases the levels of those cyclic AMPs in the lungs. And the thought is that these higher levels of cyclic AMP will bronchodilate or open up the airways in the smooth muscle of the lungs, reduce airway swelling and inflammation, and it may also help reduce mucus in the lungs. So for now, Ensifentrine is approved as a maintenance medication for adults with COPD. And the goal is to use this to prevent flare-ups or worsening of COPD symptoms such as coughing or wheezing. Studies show that giving Ensifentrine via nebulizer twice daily improves lung function more than placebo. And just to reiterate, Ensifentrine is not a rescue medication for acute symptoms. It's for twice daily use every day. I do want to note that over half of the patients in the clinical trials for Ensifentrine were also taking a LABA or long-acting beta agonist or a LAMA or a long-acting muscarinic antagonist with or without an inhaled corticosteroid. What these initial trials did not include was patients on a combo LABA-LAMA or triple therapy of a LABA-LAMA with an inhaled steroid. Plus, we don't have any data comparing Ensifentrine to these treatments or to the oral PDE4 inhibitor roflumilast. You'll also hear Ensifentrine reduces exacerbations. And just want to note here that this is based on modeling data. The exacerbations aren't a primary or secondary outcome in key studies. And we don't have much long-term safety or efficacy data yet either. We just have a smaller subset of patients that were treated for 48 weeks in one trial. So this may have you asking yourself, what's the role of Ensifentrine? For now, expect specialists to save Ensifentrine for patients as a last resort or if they can't tolerate standard meds. We don't have enough evidence yet, but it's good to have another option for patients if we need it. Expect to continue to see a LAMA such as tiotropium or a LABA such as salmeterol first line for mild symptoms, or the combination of a LABA-LAMA for patients with more severe symptoms. And symptomatic patients with frequent or severe exacerbations may be even on triple therapy with that LABA-LAMA inhaled steroid combination. If you get a prescription for ensifentrine, be ready to handle prior auths. It's a specialty medication and costs about $2,900 per month. For Medicare patients, you'll need to bill ensifentrine to Medicare Part B, like most other NEBs. Be sure to check prescriptions closely to make sure they have the proper documentation, including that diagnosis code and exact directions for use. And if you dispense ensifentrine, we as pharmacists and techs are in a prime position to help ensure they know how to use it properly. There are a few nuances, so how should patients use ensifentrine? Comes as an inhalation suspension in unit dose ampules, and it's given twice daily via a standard nebulizer. It's important to confirm that patients have a nebulizer machine before they leave the pharmacy. There are some cases of patients drinking inhalation solutions, so we want to make sure that patients know this is not for oral use. And since ensifentrine is a suspension, patients will need to shake the ampule well immediately before using it in the nebulizer. And they will also need to be aware that it's normal for the med to appear cloudy and yellow or pale yellow in color after shaking it. And also, patients should not mix ensifentrine with other meds in the nebulizer. And in regard to side effects, ensifentrine is well tolerated. There are very rare reports of suicide-related events with ensifentrine use, so patients should report any mood changes immediately. And then be aware that ensifentrine may rarely cause back pain, blood pressure increases, and diarrhea. And now for some practice pearls. Be sure to check the prescription directions closely. As we said earlier, we want to make sure via nebulizer is in the SIG, and then clarify any ambiguous or incomplete information. For instance, a quantity of 60 could mean 60 vials or 60 mLs, and then make sure that there's a diagnosis code and exact directions, especially if you're billing Medicare Part B. We also want to calculate day supply carefully. Be aware most payers require inputting the total number of mLs for the quantity, but using the number of vials or ampules to determine the day's supply. So, for example, you'd enter a quantity of 150 for a box of 60 2.5 ml ensifentrine nebs. And then you'd enter a 30-day supply if the patient is to use one of those ampules twice a day. And also regarding storage in the pharmacy, you'll want to be sure to store it in its original packaging at room temperature. And then tell patients to do the same at home. Once that pouch is opened, it should be used right away. We mostly talked about ensifentrine today, but we have a great chart online called Inhaled Medications for COPD, which gives more detail about how the different treatment options stack up. For instance, the LAMAs and LABAs we talked about, and then all the different combos. The chart includes dosing specifics, med costs, and other considerations.
We hope you enjoyed and gained practical insights from listening to this presentation. Be sure to follow or subscribe, rate, and review this show on your favorite podcast app. Or find the show on YouTube by searching for TRC Healthcare or clicking the link in the show notes. While you're there, check out our other TRC podcasts like Medication Talk and Rumor vs. Truth. Also in the show notes, we've linked directly to a few of the excellent resources mentioned today, available to subscribers of Pharmacist Letter, Pharmacy Technician's Letter, or Prescriber Insights. On those websites, you'll also find a lot more evidence-based, concise, yet comprehensive resources on this and other medication therapy topics. If you aren't already a subscriber, don't miss out on these resources. Sign up today to stay ahead with trusted insights and tools. We are an industry-leading, non-biased source of information and continuing education. And if you're a student, good news. Students can access a free version of Pharmacist Letter. We've linked to that directly in the show notes as well. Check it out. Find out more about all of our product offerings at trchealthcare.com. You can also reach out to provide feedback or make suggestions by emailing us at contactus@trchealthcare.com. Thanks for listening to Clinical Capsules.